Welcome to Market Access today. Please get ready to be captivated with expert insights and explore new frontiers. Many thanks for the interest that you have shown to our first video so far. And in the meantime, as usual, I want to thank to Econics for their unconditional support. So now let's get started. Today, I have Amir Sharaf with me, and we will try to cover Middle East and Africa topics with a little bit of Tunisia focus today. We are aiming to cover every other country in the region within the upcoming videos, so please stay tuned. I want to start with asking a little bit about yourself. Please, Amir, can you please just let us know what is your background, what have you been doing so far within the region and also in the healthcare industry?
Hello, Öznur, and hello, everybody. And thank you very much for having me today discussing this market access topic, which is actually very interesting. And thanks to Market Access Today, too. Let me briefly introduce myself. I'm Amir Sharaf. I'm a medical doctor by origin formation, and I have been working in market access since for now more than 13 years. And I have gained experience in market access of pharmaceuticals in Europe. Precisely those who are going into phase 2 and phase 3 and that are wishing to access the market in Europe. In parallel, I've been also practicing, and I have dealt with many markets and many cases of innovative pharmaceuticals and generics, as well as drugs for orphan medicines, orphan diseases, and biosimilars. And in these regards, I've worked a lot in the Middle East region, Northern Africa region too, as well as the Gulf countries. So that's me in a nutshell. Thank you.
Thank you very much, Amir. So I will proceed with asking my initial question. Could you briefly describe Tunisia's healthcare system from the pricing and reimbursement body's perspective? And also, it will be great if you can a little bit detail about the mechanisms of distribution as well.
Tunisia is a very known country in the Middle East and Northern Africa region for many reasons. And let me briefly introduce it as a small country, geographically small country of the Northern Africa part between Algeria and Libya, covering something like more than 163,000 kilometers square with a population of nearly 12 million people. Tunisia is classified actually as a lower to middle income country, and it has public universal health insurance system that is funded by taxation. The system is run by something called the CNAM, which is the abbreviation for Caisse Nationale Maladie. By the way, the official language in Tunisia is Arabic, and the second languages are the French, and afterwards comes English. Back to the health system, this case that we call it the CNAM provides care for most of the population, and the services, healthcare, are organized in the country on 3 levels, as many others that are actually on the, let's say, or following an example of a French system of universal healthcare. There's the primary healthcare service, followed by the secondary and the third or the tertiary levels. And what is specific or what's special about Tunisia is that it is developed well compared to other neighboring countries in the region. By the way, Tunisia was among the first countries in the region to have this well-developed healthcare system installed and a good and efficient running pharmaceutical industry supporting it. To give you an example, the primary care is actually composed of something like more than 2,000 centers with around 100 circumscriptions hospitals and hemodialysis centers. And the secondary level is, supported by more than 30 regional hospitals. And the third level, again, close to 30 university hospitals and 9 specialist centers that are covering all the countries, even though there is a little bit of difference of distribution with the concentration of the most of the healthcare services and institutions within or on the coastal sides of the country. It's noteworthy to say that the public system manages more than 80% of the hospital beds, and there's also a very well-developed private system that has been developing very, let's say, recently, but it's actually continuing to develop well with something like 100 private clinics and hemodialysis centers and more than, can you imagine, 2,000 pharmacies that are distributed all across the countries. Again, the services here, especially concerning the private sector in terms of clinics and outpatients clinics, are more distributed again in the regional the regional sides or the coastal sides compared to the inside of the country. The healthcare system is going very well, actually, in Tunisia, even though there have been some surveys that report that there is a little bit of dissatisfaction of the population with the national or public healthcare system. There have been reforms for the health insurance to allow to cover services that are given also by the private healthcare system. But again, it's more than 70% of the population that are covered by the CNAM. And there's another body called the CNSS, for the Caisse Nationale de Sécurité Sociale, National Fund for Social Security, which simply corresponds to covering patients who are working in the private sector. There is also a system that the government has installed since a long time to support the populations that are not able to afford either system, the private or the public one, so they are given the services for free. So this is, in a nutshell, the healthcare system and how it evolves. For the pharmaceuticals and pricing system, actually, again, I want to reiterate that Tunisia was among the first countries to have a well-established pharmaceutical industry based on a well-structured regulation. The country organizes the pharmaceutical care system production, import, and distribution thanks to a well-established structure driven by what we call the DPM, which is the Département des Pharmacies et des Médicaments, the Department of the Produits Médicamenteux. This body, it's the Directory of the Pharmacy and Medicine, This body manages all the administrative aspects related to the pharmacies and all what's related to getting the marketing authorization approval and the commercialization of the imported medicines as well as the produced medicines. So it has a kind of supervisory role for public bodies, and it has been already operating under the WHO collaborating center since 1998, which is actually very good. The DPM actually receives trainees from all over the world and also sends its delegation for the exchange of experience. And in this body, let's say, supervises another list of bodies like the LNCM, which is the National Pharmaceutical Control Laboratory, which, as the name indicates, it's to control the national pharmaceuticals production and to carry analysis and evaluation studies of the medications, etc. So it's under the also the supervision of the Ministry of Health, and the DPM also supervises the Pharmaceutical Inspection Department. Again, as the name indicates, it's inspecting. So again, also under the supervision or the directorate of the Ministry of Health, and ensures compliance and adherence to the laws and the regulations. Then there is also the CNPV, the National Center of Pharmacovigilance. As the name indicates, it's for the pharmacovigilance. And now we arrive to one of the most important bodies, again, which works in collaboration and in a strong network with the DPM and the other, which is the Tunisian Central Pharmacy, which is the unique distributor of pharmaceuticals here in Tunisia, especially with regard to the important medications, vaccines, serum, and all the related products. It has actually the sole responsibility for supplying these to the public health facilities, and it is actually, established following a Tunisian state strategy. Actually, the PCT, the Tunisian Central Pharmacy, PCT for Pharmacie Centrale de Tunisie, actually controls the drug purchasing costs and ensures their qualities and manages a strategic medication reserve. Again, maybe the question that appears here is how it goes for the medicinal products. The medicinal products needs to be first registered in Tunisia, and here, it's the DPM, which is the reference, that's where to go. And there is a whole list of procedures that ones need to follow to have the medication registered. Once registered comes the pricing part. And here the country uses, as many other countries in the Northern Africa, Middle Eastern region, as well as in Europe, the external reference pricing as a dominant method for the inpatient medicines. There's also a value-based pricing too, through health technology assessment, which has been also running in the country since 2012 or 2014, and had been recently used to help the reimbursement decision for the inpatient medicines. But actually, so far, maybe not that used for the pricing of innovative medicines. Reimbursement generally, compared to pricing, is mainly based on negotiations and on internal reference pricing. These negotiations are run by a committee called a technical committee, which is within the DPM. And the regulations say that the marketing authorization should be granted only to medicines that are presumed to improve the medical services rendered. So it's also close to the French system of the Service Médical Rendu, SMR. And in order to bring savings to the cost of health in particular. So the basket for the external reference pricing, it exists for Tunisia. It's again for the inpatient pharmaceuticals, a little bit combined with the ERP, but let me talk to you about the ERP, the external one, when submitting market authorization applications, the manufacturers should submit also the prices of medicines at an ex-wholesaler level in 6 countries, which are Algeria, France, so you see the French system, and then Germany, Italy, and a neighbor Morocco and Spain. This is in a nutshell the pricing in Tunisia, and just to give you an example, it may be common to all the Northern African, Middle Eastern regions, but for Tunisia, for example, and this is something also common with Algeria, the price is calculated on the lowest price in the basket, which is not maybe the case for Morocco, which stands maybe as the only country that just chooses the average price instead of the lowest price. For the comparator price, it's the ex-factory, actually the ex-factory in Morocco and Algeria, but actually it's the wholesaler price, excluding VAT, which is applied in Tunisia. For the procurement, here again, we return to one of the biggest, or it's the only distributor in Tunisia, which is the PCT, the Central Pharmacy of Tunisia. But again, we are talking more about the public sector compared to the private one, because actually they have distinct procurement mechanisms. The PCT for the public one, as mentioned, while the others, if for the private sector, especially for the local manufactured product intended for the private sector, these can be distributed directly through wholesalers without the intervention of the PCT. The reimbursement, so again, we are back to the bodies of the reimbursement, the CNAM, if you remember it, and it has a reimbursement committee. And by the way, here, the CNAM is under the supervision of the Ministry of Social Affairs. And the reimbursement committee inside is the decision-making body for that. And both the CNAM and the DPM are represented within this committee. The HTA, we have already talked about it, and it is, how to say, important for reimbursement, pricing and reimbursement decision. And just to mention that the idea was here in Tunisia since 2014, but officially started in 2015 with the establishment of what we call the INEAS, which is the National Instance of Evaluation and Accreditation in Health. And it is the body actually that is running the, let's say, the study to help reimbursement decision making and also developing guidelines for the choices of pharmacoeconomic studies and the methodologies to, for example, for the analysis of budget impact. So all of this in order to have informed decision for the pricing and reimbursement in Tunisia. So again, this is a nutshell on the pricing and reimbursement of pharmaceuticals and of the healthcare services in the country. And by this, I hope that that responds well to your question, and I thank you.
It definitely does. In fact, my second question would be asking about where does Tunisia stand in the region, in Middle East and Africa region, from market access perspective. But in most cases, you already covered that part. Maybe I can just add a little bit touch point to that, which is when it comes to the region and it comes to the innovative products, which were not talking about the small molecules, but the biologics or cell and gene therapies, which is today in the healthcare world, it is called innovation. So from that perspective, what is approximately the rate that the new products are coming to the market and are being accessible to the patients in Tunisia versus the rest of the region?
That's an excellent question indeed, because Tunisia has been a pioneer in having the innovative medicines, especially with biologically engineered medicines, if I may say, or pharmaceuticals in the beginning. I mean, there is simply one issue that's still ongoing. It's about, as you said, the access. Well, Tunisia stands well compared to its neighbors, but because of budget constraints that are put on the healthcare system and the pharmaceuticals procurement system, including the importing of these innovative medicines, there may be a little bit of slowing down of the pace compared to the other countries, for example, especially Morocco or also Algeria. So again, it is a matter of budget constraints, but whenever there is an innovative medicine that comes into the country, it is very well and very thoroughly examined in terms of quality and in terms of pricing and reimbursement to be made available to the population. I may say that in addition to the budget constraints, the budget constraints could be a negative slowing factor, but the thorough examining of the innovative molecules here in the country is also a slowing factor, but on a positive vibes or in a positive way, because it really allows to select the most important or the most interesting or the most relevant to the population here. In other words, if there hasn't been budget constraints, maybe the pace of acquiring the innovations to access the market would be much faster, even though it will also be the bodies will take all their times to evaluate their quality and pricing, etc. But at least there would be much more candidates for that. So the country is not maybe among the best now in terms of the acquisition of the innovative medicines, but it's certainly not among the least. So we really hope that the situation gets better with, less budget constraints in the future and more pharmaceuticals to access the market.
Thank you very much, Amir. So my final question is, in fact, what we do see in the region is there's a new social health insurance program in which the employers and the employees pay premiums into a health insurance fund. And for those who are insured, these monies are used for their hospital stays, doctor visits, or any other related medical expenses. Do you think this model would work well and perhaps get more attraction in the area?
I was saying that actually the country, like many Middle East and Northern Africa countries, has undergone or has established some reforms for the implementation of social security and health insurance systems. But what has been observed so far, and again here this comes from publications, from secondary research, is that this health insurance system had increased demands from different providers, including the voluntary and private, including the for-profit and non-profit sectors. These demands increased to overcome gaps in population and in service coverage, resulting in a fragmented healthcare delivery and financing systems. Well, the reforms are still standing, and the health insurance is operational, and it is good compared to other neighbors. There are examples of chronic diseases that where the medications are fully 100% reimbursed, and here I'm talking about patients in the public sector. But there's also the coexistence of the private sector and the private health insurance too. And again, back to your questions, there are employers who are dealing with the private insurance companies that are covering the costs of medical interventions, treatments, and pharmaceuticals delivered for their employees. So be it in the public sector or in the private sector. My point is that there are private health insurance companies that are working with the private employment sector or the private economic sector in the countries, and that's also doing it great. But this system increases a little bit the budget pressure or constraints or over the national, from the national perspective or over the national budget, as generally the CNAM, which is for the public sector, or the CNSS, which is the private sector, that are reimbursement. What is new is there is the advent of the private or third-party payers. And they have been recently established in Tunisia, and they are progressively working and, getting within the working market. And you can see today patients having specific electronic cards from these third-party payers. And there are also electronic card systems that are being delivered also by some of the private health insurance. That is to say that now it makes life easier for the private sector workers, and hopefully this could decrease a little bit of the pressure put on the budget on the national level.
Thank you very much, Amir. Today, these are all questions that I prepared to ask you. And thank you very much for this valuable and efficient discussion. And I'm hoping to be seeing you with us in the upcoming videos to be focusing on the other countries as well. Thank you.
Thanks to you. Thank you very much. And thanks for Market Access today, and hope to see you very soon, hopefully face-to-face here in Tunisia.